Well, good evening, everyone. Thank you for joining in the series called Behind the Revenue. I would like to introduce you guys with Dr. Stephanie today and Dr. Leon, who's helping us out, collaborating with us to actually learn more about the physician's own experience and see how we can help the new ones out there who are just getting out of the school. Today we have Dr. Stephanie, and Dr. Stephanie, it's a pleasure to be connected with you. Thank you so much for taking out your time for this new series. We would love to share I'd like to have actually your experience, hear about us a little bit, and if you'd like to introduce yourself, that would be great for us.
Yeah, absolutely. I am Dr. Stephanie Zwonitzer. I am a nurse practitioner, so I have my Doctor of Nursing practice degree, and I have been in practice for about 9 years. I have done a variety of things, but most significantly, urology and sexual medicine for the last 5 years. I
Mhm.
absolutely love this area of medicine. It's a really unique area to help people reconnect with their partners, get their own ego and self esteem back, and of course, being able to pee is an essential function that we all need, so that's helpful as well. I recently men and women balance their hormones and improve their sexual wellness.
Oh, that's wonderful to hear. But I've seen, Doctor, since your profession is traditional medicine, but you're currently practicing in a different way with different specialty. What's your thoughts on that? How do you decide to go with in this field?
Yeah, it's such a great question. In this area of medicine specifically, you really need time with your patients to get past the barriers because we're all embarrassed a little bit to talk to someone new about sex, about our private parts, about all this stuff. And so, in a traditional setting where I was seeing 20 to 30 urology patients a day, I was getting 10, maybe 15 minutes with them. You're barely breaking the ice at that
Hmm.
point, especially with things about men's erections, women's pain with sex. When you're trying to figure out, is this their hormones or is this just lack of sleep or something else? And so, with traditional medicine, it's very difficult to take the time that it needs to get past that. And also, with traditional medicine, we have very standardized testing that we do, and that is approved by insurances. And so, whereas for hormones, some hormones are better tested with blood, some are better tested with saliva or even urine. And these tests, these specialty tests with urine and saliva, are not generally covered by insurance. And insurance regulates how much time I can spend with my patients. So, to be able to really give my patients the amount of time they need to tell me everything, to develop that relationship of safety and security for them, and to do maybe compounded medicines or specialty tests, being more of a concierge style where we're a cash based clinic with programs and memberships allows me to do that. You can see me as often as you need to. We can do 30-minute visits, hour-long visits. We have a lot more flexibility in the care that I can provide and your access to me and how quickly I can see you in being more of that concierge style.
So, my first question to you actually is how does that affect your treatment protocols if you have one patient that needs an hour and hello?
Yep, Doctor, we can hear you now. We just lost you for a second.
Oh, there we go.
Okay. So I think what you're saying is you're wondering, like how do I make that differentiation between who gets what amount of care and how? Honestly, it's really patient dependent. I generally schedule an hour for every patient visit, and that way they have plenty of time to talk to me. Sometimes we use that full hour, sometimes we don't. Especially for newer patients where we're really getting into that balancing their hormones and we're really trying to pull back the layers of what the root of their problem actually is. Those are definitely the appointments that are taking longer. Once we get them feeling better, they're a little bit more balanced with their hormones, and we're just checking in to see if we need to make little tweaks here and there. Those are shorter appointments, but I like to book a full hour per appointment just to be able to allow the patients that flexibility of whatever they need that day, I'm here for.
Oh, that's wonderful. And do you think insurance will limit this? If you go in by the insurances, that will limit your time, that will limit your, you know, the convenience of the patient, right?
Yeah, I mean, I think definitely. So, you know, with reimbursement from insurance, it's more of a volume based to make ends meet, to make that money as a provider, right? And whereas a
Mhm.
concierge style, I can see a lot less volume because I'm getting a better reimbursement rate by setting my own prices. So while I wouldn't advertise that to my clientele, to other providers, I think that's a nice way to look at it.
And do you still face any kind of challenges in terms of, collecting cash, or, if are they hesitate when you ask for the revenue in terms of, like, because most of the insurance people that we spoke to, or the clients that we spoke to, they already stick with insurances, and their client doesn't bother, or the patient doesn't, reevaluate just this thought that they might be charging a little bit more or anything like that. Have you ever occurred these kind of challenges where they ask, you might
Yeah,
be, charging a little
absolutely.
bit more than the usual providers?
Yep. So it's definitely one of the top questions
Mhm.
that comes up and can actually be a barrier to patients coming on board with me, because they are so no,
Mhm.
used to the insurance model where you maybe have a $20 or $50 copay, something along those lines. But what I'm finding is that because this particular niche area is not a forefront of med school, NP school, et cetera, that we don't really
Mhm.
focus on it a whole lot, there's not a ton of really great providers in this area. And so to find
Mhm.
someone is difficult to begin with, and to find someone who accepts insurance and a plethora of insurance companies is even more
Mhm.
difficult. So I'm actually finding that most patients are willing to go ahead and pay the money, especially when you reframe it in more of an investment into their health,
Mhm.
and into their
Mhm.
future, rather than, this is just the cost of coming to see Dr. Stephanie.
Certainly. What usually makes a patient say yes to your services, according to you?
Well, I would like to say it's me and my personality. But I think it's kind of a couple things. I think number one is, yes, who I am and whether or not they know me, whether or not they've had me as a provider in the past in traditional medicine, or someone that they know has. I get a lot of word of mouth referrals, and then
Mhm.
also I think it's a very specific niche. Again, I think that patients really look for someone who is willing to take the time with them in this particular area of medicine. And most practitioners in traditional medicine can't afford to spend the time with them, because they really, again, that insurance based is more of a volume based medicine than it is
Mhm.
time based.
Certainly. But do you think a sexual health and the hormone care can be a sensitive topic, even though still now we're in 2026? But how do you build that kind of a trust with the patient initially? Or is it
Yeah,
just me
absolutely.
thinking that there are some, barriers or trust issues? What do you have
No,
seen
you're
with
definitely
your
spot
experience?
on. Yeah, spot on. There are definitely trust issues, especially because for so many men and women, they were told, oh, this is just part of aging. Well, your labs are totally normal, and they've been dismissed. That pain with sex, just have a glass of wine and you'll be okay. So they've been dismissed with their symptoms over and over, that it's really difficult those first couple appointments to establish that rapport and say, that's not the way I approach sexual medicine. I want to know what's going on with you. Where did we get to, how did you get to this point? And then what are things that I can do, both, prescription wise, but also lifestyle wise. I mean, some people just need to be taught about lube and they don't understand how important that is. So it can be as simple as, which lube to pick out at the grocery store versus, putting you on multiple hormones, progesterone, estrogen, and testosterone for some of these ladies. There's this whole gamut here that we're talking about. And so it really is establishing that rapport. For me, I use a lot of humor. I use a lot of my own personal stories or patient stories, obviously HIPAA compliance and changing names and all that kind of stuff. But really just establishing, hey, I've seen this or I've been there. This is the outcomes I've had with patients or myself in the past. And that really busts through that barrier of, that trust.
Mhm. Indeed, indeed, that makes sense. And
What
do you also struggle with more patient acquisition or patient retention in this area?
It's a great question. Acquisition, a little bit in the sense of Again, they've been dismissed so many times. Some of them just don't even want to try another provider. But the retention is pretty strong. If they're just coming for, erectile dysfunction or orgasm dysfunction, and we kind of get them in a place where, maybe their tadalafil can be refilled by their primary care or something, yes, I would lose some of those patients, because they're not going to pay cash to see me in a monthly membership if all they need is one prescription a year, right? That would be silly, and that would be unethical of me to expect them to do that. But the hormone patients, they're here for a long time. The keeping them around is easy because they feel so good once you get their hormones balanced.
True. Like, why wouldn't they?
Right.
All right.
Yeah.
But let me ask you this. How do you explain the value to a patient who are actually used to, the insurance covering for everything?
Yeah, that's a great question. I think, the first and foremost, I talk to them about the time that I can spend with them. And that's usually a big selling point. So I talk to them about the time that I can spend with them, and also the specialty labs that we're going to do that they wouldn't necessarily get in traditional medicine. And because I order so many of them, I have discounted rates with those lab systems. And so I can get them at pretty decent prices. Whereas if they went to another provider who doesn't do them very often and isn't familiar with them as much, they would be paying the full price for them. And then also the access to me. I don't have a 6-month wait to see me. If there's something going on, message me through the portal. I will get back to you immediately. I can probably get you in with an appointment in a week to 2 weeks at the most. So I think they're paying for the accessibility, and they're also paying for my knowledge. I've been doing this for a while. I've taken extra courses. I've done extra certifications. I know what I'm talking about, and I'm pretty darn good at it. So they're paying for that too.
That makes sense. Let's just talk about the biggest challenge that you ever faced. Initially, when you started up, and in the building, the consistency in the revenue in the beginning, how that was looking to you. What was that
Yeah.
challenge that most of the provider face in the beginning for the revenue, especially when you're cash based?
Yeah, for sure. It was terrifying to start. It still is a little terrifying. Mostly because we know the medicine side. That's what we went to school for. That's what we know. And so all of a sudden, I also need to know how to do QuickBooks and how to get my EMR started from scratch, when I've only ever worked from companies that already had an EMR up and running and templates already ready for me. So some of it's fun because you get to make those decisions, but it's also really difficult and overwhelming because that's not what I was taught. That's not my forte. The best thing I did for myself was get good people in place to help me. I hired an accountant who can help me with all of the managing of my money and my funds. I got a business mentor who can help me with the business side and the marketing side. And then I hired a mentor specifically in hormone replacement therapy to make sure that I was doing a good job setting up my clinic in regards to hormone replacement. And so getting the right people in place for me has been huge and so much more benefit than they ever cost me. I'm fortunate in the sense that I had a chunk of money set aside to do this. And so I have not had to take out business loans yet. Also, I'm fortunate that I'm doing telehealth, so I don't have as much overhead as if I opened a brick and mortar. So that's been helpful also. But man, it's going to be really nice to pay myself back one of these days once I start getting more revenue coming in.
To that. So, at what point do you thought to start your own practice, private practice, go in this area, help the people out there? We're actually suffering a lot, based on this. At what time you thought it would be nice to now just go alive and help these people out individually?
Yeah, it really was most of my ladies coming in and having urinary symptoms. So the genital urinary syndrome of menopause, they're having frequency, urgency, dryness, pain, irritation, and they keep thinking they're getting UTIs. And some of them are getting UTIs. And they just don't understand that the basis of those symptoms are actually not urological in nature, but they're hormone in nature. And so I would talk to them about that, and then they wouldn't have anywhere to go. Their GYN didn't want to do it. Their primary care didn't want to do it. And so I was like, well, screw it. I'll go learn how to do it and I'll be the one that does it. And the company that I was working for at the time, they were going through a lot of corporate shifts and being bought out by entities and things like that. And so some of the changes that were coming downstream to what nurse practitioners were going to be allowed to do within the company and pay structure and things like that were changing more towards the negative for my position, in my opinion. And so I thought, well, there's this need out there. I've already gotten the education so I can be that person. And I think this is just the right time to go do it on my own and try that out. And best case scenario, it's a slam dunk and I do very well. And worst case scenario, I'm still a nurse practitioner and very employable by another company. So, time to give it a go and see what happens.
Was it scary though, making that decision?
Oh yeah. Yeah. Very scary. But I think, what did it for me, and it was kind of, I'm going to try not to cuss on here. So kind of like an FU to the company, because I emailed the CEO that day and was like, hey, I've been hearing about these different things that are coming down the pike. I've been here for a while. I really kind of want to know what's coming to plan for my family and all of those things. And his response was, you'll know when we tell you. And I said, okay, big middle finger. Let me go file my LLC. I'm out of here. And I did. I filed for my LLC that day.
And that was the smartest decision you ever made in your practice, because at that point you took ownership of your brand, which is the most important thing in practice, is owning who you are and letting people know that that is you, because that is your value to the practice. 100%.
Thank you. Thank you.
Certainly. I've seen a lot of providers who actually, in RevMedics that actually are so thirst, so, anxious about their patient and everything. Do you think sometimes providers underestimate the side of the business in the healthcare too?
Oh, for sure. For sure. Again, we're not taught it. We don't know. And so, I think sometimes we're like, oh, well, it'll just come naturally because I'm really smart. I know all this medicine stuff. I worked really hard to get here. But it's completely different. It's like a whole nother side of my brain. It's a foreign language. All of a sudden, I have to know my income and my expenses and this P&I report and all this other crap that I've never learned or heard before. But yeah, getting the right people in place to help coach me and mentor me has been astronomically helpful. I mean, I don't even think I would have opened my doors without the right people in place, because it's terrifying to start when you don't know what you're doing.
And you're putting yourself completely out there, and you don't have the income that you need when you're starting out. So it's either you, and it's sink or swim moment.
Yeah.
So you got to swim.
It is. And marketing now is so different. You have to get over yourself and put yourself on social media. You have to put a billboard with your picture on. And in your head, you're thinking, man, who have I pissed off in my life? Who's going to see this and be like, oh, Stephanie, whatever. But you just have to get over it and say, that's okay. This is me. This is who I am now. Past versions of me don't matter. And I'm ready. Bring it.
Did you find any challenges in trying to figure out the marketing of which hole to put yourself into?
Yeah, for sure. I definitely got a marketing specialist to come on board with me. So we have really hit hard on social media, and that's actually been the biggest influx of patients has either been word of mouth or social media. So we hit social media pretty hard. We're on TikTok, LinkedIn, Instagram, and Facebook. And what was really great is because my marketing person understands all of that and the algorithms and things like that, they helped me formulate a plan of when to post what my cadence of posting is, and all of those things, which was, again, a foreign language to me, but now I've got down pretty good. And that was very different for me. We did some direct mailers. I haven't really seen as much response or as significant of return on that. So I wouldn't necessarily recommend that off the bat, at least based on my ROI. I have not done a billboard yet. That's on market for later this year, possibly. I do have some colleagues who have been very successful with billboards, but it's
Uh-huh.
definitely figuring out these email streams and sequences and how to capture emails and all this stuff that I had no idea how to do, but luckily there are smart people who do. So they've come on board and helped me figure it out. But it was definitely a challenge trying to decipher where to market and how best to spend my money.
Certainly. It's always about to find the right people to do the right job.
Mhm.
And let's just say, um, what would be the advice from your end for the provider who's just getting out of the school the way you did in the past and who doesn't have any idea or any algorithm in their mind, like what exactly we will be doing once we will be getting into the industry or in the market, by their
Mhm.
own? What do you think, like, you can say to your, viewers back self?
Yeah, I think be open-minded. Try a job. If it works, great. If not, go find another one that you like better. Try different things. I tried primary care, I tried pain management, and I tried urology, which I know is a little different for physicians. You guys go through residencies and
Mhm.
fellowships, so you're a little bit more kind of niched in there. But if hospital life isn't for you, find a clinic. If a clinic isn't for you, find a hospital. There's a lot of different avenues. Don't
Mhm.
pigeonhole yourself. And if the opportunity to go out on your own presents itself, go for it. Just surround yourself with the people who are going to be your biggest cheerleaders and help you in all the different areas that are not your expertise.
True, true. This is something which we have seen so far a lot of the times, that most of the providers, they just got out of the school and they taught it to treat the patients, but they don't know exactly how to, write the notes, take care of their side of the insurances, or even though, just the progress notes and all this stuff, because this is something which they're not taught to be actually in the medical school to, go over this documentation. Otherwise, you won't be getting the bill out. Otherwise, you won't be getting your money in. So it's very pretty much difficult for the newbies out there who are just starting up, because all they want to do is help out these patients. That's what they want to do all the time. So
Yeah,
let's
it
just
is
say if you go
difficult.
back in certainly, let's just say if you go back in the time and where you what was the biggest mistake, or I would say something that you learned from your past, that you think I won't be doing this in the down the road, I won't be making sure that this is something is not going to work for me.
Yeah, my biggest thing was getting my notes done on time. When you let your notes stack up, you will forget details. If you'll get burnout, seriously, because these notes,
Mhm.
they stack up very quickly. And if you can't remember Tom Allen from Tom Smith and you're sitting down a week later trying to write these notes, you're going to get yourself in trouble because you're going to document something incorrectly and it's going to come back to bite you in the ass. So document as you go. It's so important. If you can't completely finish your note before you go into the next patient, smart text it, do something to tell yourself exactly what you need to go back and formulate into nicer sentences. But definitely, if it wasn't
Mhm.
done or if it wasn't documented, it wasn't done. And if you document incorrectly, that just opens you up to a whole lot of litigation. So stay on top of your notes. That was a big
True.
learning curve for me.
And I would agree with you because
Indeed,
I've done it
indeed.
both ways. Where you've done it, where you wait till the end of the day and you have your stack, and it ends up taking you 2 to 2.5 hours. Versus if you take 5 minutes in between patients, you end up at the end of the day with notes that come at the moment where you're seeing the patient, and you get
Yep.
the results that you want, which is accuracy, which is so important.
Yes. Yes, for sure.
Indeed.
Indeed, but
Since
this
the
whole
the
idea.
insurances are changing their go ahead, doctor.
No, no, you go first.
I was just saying, since the insurances are getting, the scrutiny is getting higher, everybody wants to make sure that you're writing everything in a very accurate manner. Insurances are getting brutal in this way. I believe nowadays the provider needs to document everything in a very right manner. Some of them are need to be get taught by someone who's actually take care of these things, the coder side of it, and
Mhm.
even if you're learning, because otherwise they're gonna come back someday, charge back audits, all of that stuff, which you need to avoid. What do
Yeah.
you thought
You
about
do.
it, Doc?
My
Yeah, I
thoughts is
completely agree with you. Especially if you have to do your own billing, if you're trying to put the codes with it, there's some great cheat sheets out there on how many labs have to be for, or prescriptions or tests have to be for each level of billing and things like that. Learn it. Keep your cheat sheet next to you while you're doing your billing if you have to until you learn it. Because you don't want to be flagged by the insurance companies or Medicare that you're overbilling or underbilling. So that's really important as well, for sure, to just kind of figure all that out. And if you don't know it, there are tons of classes online that'll teach you.
Also, one caveat is Medicare will quarterly put out a list in your area of what procedures and how your numbers compare to everybody else. Don't go above what the neighborhood is doing. It's just basic rule of thumb. It makes you stick out and makes you more interesting versus if you do what everybody else is doing, you're doing okay.
Yeah, absolutely. I remember when I was in pain management and I got my quarterly numbers and my opioids were so much higher than the average, but that's just because that's what I was doing. But yeah, I was like, oh my gosh, I'm doing something wrong.
No. It's that their data set is a little bit skewed because they're looking at everybody in the pool instead of the pain management guys, which is slightly different.
Yes, absolutely. But it was a shock when I first opened that email.
But you know that there are a lot of docs out there that'll take that, look at it, and throw it in the trash without even thinking about it.
Yep.
And those are the ones that get in trouble because they're not paying attention to the whole practice, which is the whole point of why we're here, is that in school you're trained just this sliver of treat the patient, make the patient better, and then write your note, move on, and hopefully you get paid at the end, which is not how the world really works. Is you do have to have from the beginning a solid foundation of where you're going. So you have to know, if I see this kind of patient, this is the result I do expect, and this is the protocol that I will write to achieve that result. That is just about numbers and patients coming through the door.
Yeah. One thing that really helped me too when I was getting started was making my smart text phrases. So when I first got into urology and I had to remember the difference between what I do for a gross hematuria patient versus a microhematuria patient, I would make my smart text. So while I was in the room with that patient, I would just hit .micro and it'd be like, oh yeah, I need to talk to you about this. It just jogs your memory while you're still kind of learning your area too. And then half my charting is already done. And I always put everything in my smart text, so every option for that patient, and that way I can delete what's not necessary, because typing in takes longer than deleting out. And I'm a fast typer, so I don't use dictation, but I know a lot of people that do. You have to go back and reread it because dictation will get things wrong.
Yes, 100% I do agree with you. But that being said, voice dictation, especially when you're trying to keep your hands free to treat a patient, is so invaluable in my opinion.
Yes. And the AI stuff is getting a lot better.
Oh yeah, without question.
Indeed.
Yep.
But
the one question that I would like to ask every provider, I believe, is very simple. Do you want to become a doctor, from the childhood, or have you decided to, become someone now, you want to go in a different profession, and suddenly you thought, I would like to, care about the people? What was that?
Yeah. So great question. We found when I was graduating high school, I had already decided I was going to go into nursing school, and you know how you put everything out for graduation. We were going back through my stuff, and there is a picture from kindergarten of what I want to be when I grew up, and I drew a nurse. So apparently I have always known. I did not at kindergarten think I was going to go into sexual medicine. I'm pretty sure in kindergarten I did not know what sexual medicine was. But yes, I have always wanted to go this route. And really for me, going the NP route, I just got sick of not understanding why the physician, when I called and said, hey, my patient's blood pressure is up in room 12, and they would adjust their metoprolol. And then I'd call about patient in room 14 and they'd adjust the amlodipine. And then I'd call about the next patient and they would adjust one of the other ones. And I was like, but why? Why is each patient getting one different? And that was the moment that I realized that I needed to go back and become a provider where I knew those answers and I got to be the one making those decisions.
Right. Because in the end, you're the captain of the ship, and these are your patients to steer.
Exactly.
And you want to be able to make sure that those decisions that you make, you can live with, you can own them, and that you do right by that patient. And you can't do that when you're not the captain.
Exactly.
True. True.
100%.
Now, how can your patients, or someone who's actually seeing you right now and would like to speak to you because they think that this is something that we need an assistance with, and they wanted to reach out? Do you
Mhm.
wanted to share a social media platform or something like that that they can reach a
Yeah.
website where they can reach out to you?
Absolutely. So the website is reviveish.com, and that's also the handle on social media is at reviveish. And the easiest email to get to us is info@reviveish.com.
Wonderful. I wish you that a lot of people will be actually reaching out to you. But I know after this podcast, we're actually suffering from these, area, and definitely wish you very, very luck. And down the road, if we are collaborating or if we are will be, maybe we'll be actually motivating a lot of other providers out there. So just wish them luck too. That who are actually getting
Yes.
out of the school. Me and Dr. Leon is actually trying to make a difference. Help them out, let them know before something hits them. We actually are getting some guidelines for them to make sure
Yeah.
that they actually know what exactly they need to learn before they get out of the school, or even if they are just getting out, they need to make sure that they need to learn something about these insurances, how to treat the even how to treat the patient. This is something which they already know, but what exactly the other challenges that they might be getting once they're out in the market. So
Yeah.
we'll be happy to do
Absolutely. I
that.
wish you guys all the best of luck with that. That's a very exciting time in your life.
Indeed, indeed. And again, thank you, doctor, for joining in today. It's a pleasure to be connected with you and pleasure to learn more about you and your experience and your practice. We wish you all a very, very luck. And thank you, Dr. Leon, for joining in too. We will be talking soon. Indeed.
Thank you so much.
Thank you so much for joining in. You have a wonderful night.
You as well.
Take care. Bye bye.